A total of 316 nurses and midwives graduated at Parenyatwa Group of Hospitals last week. The question has been, can Zimbabwe reverse the brain drain in the sector? More in the following report.
Up to 2,600 nurses are said to have left Zimbabwe in 2021 and 2022 alone. And last year and this year, more could have left for jobs in the UK and Europe. According to the UK's Home Office data, between September 2022 and September 2023, 21,130 Zimbabweans were given visas to work in the UK as nurses or care workers. That perhaps summarizes the brain drain situation that has crippled Zimbabwe's health sector. The Minister of Health and Childcare says the latest additions are crucial for the country.
My ministry recognizes that the health workforce is critical to the attainment of Vision 2030. It is against this background that the Ministry of Health and Childcare has developed a health workforce strategic plan 2023 to 2030 to address key human resources for health issues and gaps.
Minister of State for Harare Province Charles Tawengwa also spoke about the significance of the event.
As we align our efforts with Vision 2030 and the National Development Strategy 1, we are committed to building a resilient healthcare system that meets the needs of our population and contributes to the overall development of our nation and ensure that no one and no place is left behind.
Given the shortages of health workers, the 316 that graduated seem to be a drop in the ocean. Some of the graduates believe the job requires people that have courage and dedication.
Takaunganira kupembera kudzidza kwatakaita nokukunda zvidzidzo zvedu. It's an achievement because it takes the courage kuti someone qualify kuva nurse because the course is so packed and unofana kunge uri equal to the tasks kuti udi ukunde.
Among those that graduated were some individuals who passed with flying colors and managed to get special awards.
This wasn't an easy journey, as nursing is something that requires someone who is dedicated. If you are not dedicated, you won't be able to finish this course, I tell you. So it wasn't easy. It involved a lot of hard working, there was a lot of pressure. There was a lot of pressure, as you can see, you'll be in need of social life. But in nursing training, usually there's no social life because there's a lot of pressure.
There is also the general brief that nursing is tough, and it takes one to have the calling before training.
So the experience was quite interesting because it was actually the first time to find out what happens in midwifery, what midwifery is all about, and what we were supposed to do as a midwife. And then we went for internship for the second year. We got to learn and we got to experience what we're supposed to do in the midwifery field.
And for many that graduated here, it could not have been possible without family support.
Today I'm super excited because, as you can see, she took almost every award which was on the table, and for the past 2 years that she has been learning about midwifery, it's not been so easy because sometimes she could wake up early in the morning around 2 a.m. Studying, preparing for exams, and also putting a lot of effort in all this.
Today they don the cap, tomorrow they change lives. With compassion, skill, and dedication, these newly minted nurses embark on a journey to heal, to comfort, and to care. But for the country, the prayer is they stay to serve the country for as long as they can. For ZTN Prime, I am Gamchiraisa Pazua in Harare.
Konapo Ipapo ba ZTN Prime, DSTV channel 294, the place to be.